The Minister of State for Education, Malam Tanko Sanono, says the federal government is addressing the challenges of mental health among citizens in the country. The minister, who was represented by the Director of Special Duties in the ministry, said that mental health was a collective concern that affects communities and the nation.
As we gather here, we are reminded that mental health is not merely an individual issue. It is a collective concern that affects families, communities, and the nation at large. The youth, who make up a significant portion of our population, are the future leaders of Nigeria. Their well-being is critical to the progress of our society. Yet more and more young people are facing mental health challenges such as anxiety, depression, substance abuse, and even suicidal thoughts. These issues have been exacerbated by various factors, including economic uncertainties, social pressures, academic stress, and the impact of digital technology. As a government, we are committed to ensuring that mental health becomes a priority within our education system. To address these challenges, we are focusing on three key areas. The first one is awareness. The second one is access to mental health services. And the third is reducing the stigma associated with people with mental health. First, we must raise awareness about mental health, and I believe this is what you people are doing here today. By the time we do more of this, the states, the local governments, and the federal government, if we are all on the same page on issues of mental health, then that will be reduced seriously. People will be aware of it, and then necessary action will be put in place to address this challenge. It is essential that our young people understand that mental health is just as important as physical health. Too often, mental health issues are ignored or misunderstood. Through targeted campaigns and partnership with schools and universities, we will work to educate students, teachers, and parents in recognizing signs of mental health challenges and seeking help when necessary. Secondly, we are working to expand access to mental health services. Many young people who struggle with mental health do not know where to turn to for help. That is why we are collaborating with the Ministry of Health and other stakeholders to ensure that counseling and psychological services are available in our educational institutions across the country. We are also exploring the potential of leveraging technology to provide virtual counseling platforms, especially in underserved areas.
The chairman of the governing board of the AU Agenda 2063 Ambassadorial Assembly said mental health was a component that impacts on daily lives and affects productivity and interpersonal relationships.
By addressing mental health challenges in the workplace and promoting stress management strategies will contribute to building resilient and productive society as projected in the Agenda 2063. Our collective efforts today not only raise awareness about mental health issues, but also prepare us towards actionable steps that can transform workplaces into environments that nurture the well-being of all citizens. Let us seize this opportunity to advance the objective of the African Union Agenda 2063 by advocating for policies that support mental health initiatives, fostering partnerships that drive positive change and empowering individuals to prioritize their mental well-being in the workplaces.
The keynote speaker, a professional mental health and addiction therapist, called for provision of counseling services in the workplace to help both employers and employees.
These issues of mental health in the workplace is not getting enough attention. And when I say workplace, I'm not just talking about structured organizations. I'm also talking about the informal sector. Hairdressers, whoever works for you, your security man. These people can be inculcated, they can be put under these schemes. How much is it? 13,500 naira per annum. There is no reason every youth corper should not be under a national health insurance scheme. There is no reason every worker should not be under this scheme. in every organization. And I think we better start looking at it. It's just 13,500. Even your personal staff should be under it. And mental health issues should be introduced into this scheme so that they can easily walk into establishments and be referred for proper mental health diagnosis and treatment.